Welcome to today's episode of Rural Health Pulse. I'm your host, Dr. Jim Kinnear. In today's episode, we are discussing nursing education and specifically learning more about the nursing department at Indiana University of Pennsylvania. Joining us today to share some valuable insights is Dr. Theresa Gropelli, Chair of IUP's Nursing Department. Welcome, Theresa.
Hello.
It's great to have you here with us today. To get started, can you tell us a little bit about yourself and your role as the chair of the nursing program at IUP?
Well, just to give you a little background about myself, I've been a nurse for 40 years. I worked primarily as a med-surg nurse, also in gerontology. Also did a variety of different roles at the hospital prior to coming to IUP. I was a clinical educator there and also the director of nursing over one of the SNF units at the hospital. Then about 19 years ago, I decided that I wanted to make a career change. I decided that I wanted to move into nursing education full-time. I applied to come to IUP and was hired, and I've been working as a clinical nurse faculty and as initially when I first started out, and then about 10 years ago, I became the chair of the nursing department. So I've been here at IUP for 19 years.
It's great to hear your career path and how it evolved. What do you think was the thing that drew you to nursing education?
I always had a love for teaching. Even as a young person, I always had a desire to teach. When I first became a nurse, I realized I liked to teach the patients, I liked to teach the family about health education. And then probably about 1 year into my career, I realized that I was very good at working with new nurses being hired onto the nursing unit. So I was a preceptor, I worked with students, and I could tell I enjoyed education. I enjoyed teaching people. And so I decided to continue my nursing education to go back and get a master's and then a PhD in nursing. And during that time, I also decided to see if I would like to do teaching full-time. So I took a few positions where I was doing a casual type of part-time position as an adjunct at the local community colleges, teaching clinical. I did it for a couple different universities, and then I decided, to do this full-time because I could tell I really wanted to teach. I did not want to do bedside nursing, did not want to do hospital administration anymore. I wanted to teach the future generation of nurses.
It's fantastic that you were able to pursue that passion and interest in teaching and be able to continue and grow in that area. For some of our listeners that might not be familiar with IUP's nursing program, could you give a quick overview of some of the different degrees and programs that are offered?
We have pretty much 4 types of programs and a little subdivisions from that, but the largest program, the traditional BSN nursing program. This is primarily a program that students come straight out of high school, going 4 years to college, and when they graduate, they have a bachelor's degree in nursing, and then they take the NCLEX exam and pass that and would become a registered nurse. Also, we have another undergraduate program. It's the LPN to BSN. This program is kind of innovative. Students who already have an LPN apply to come to this program, and they're able to test out and waive out of certain classes, and they get a bachelor's degree in nursing. And it really depends how long it takes them to finish that program, depending on the number of credits that they come with and how do they test out of the courses or do they need to take certain courses. Then we have a master's degree in nursing. We have 2 primary focuses of that. One is a master's in education and one's a master's in administration. The master's in education is right now, it's the more robust program. Sometimes the other one is more robust, but that one primarily is preparing our future nurse educators. The other one is preparing a lot of leadership in nursing, nurse managers and growing in the healthcare field in nursing administration. Then we have a PhD in nursing, and there's 2 tracks there. One is a traditional PhD program in nursing. The focus is also on nursing education and also nursing research. The other track that's a little bit of an innovative approach also is we have a DNP to PhD program. These are nurses that have a DNP already complete more of a practice degree, and they decide to come back for more of the research-based degree. And that program has been very popular. That's a real growing program.
Fantastic. And just for clarification, the DNP is the Doctorate of Nursing Practice degree?
Yes.
Fantastic. A lot of different programs, a lot of different opportunities happening there in terms of nursing education. Tell me a little bit about your nursing students also, especially at the undergraduate level, would be going out and completing some clinical field experiences as well. Can you share just a little bit about some of the different types of settings and environments they might do some of those clinical experiences?
They get a real variety of clinical experiences. In our traditional BSN program, students go 6 semesters to clinical out of the 8 semesters they're here. They go to area nursing homes for experience. They go to a lot of local hospitals, and by local, pretty much an hour radius. The hospitals vary. Some are very much community, rural-based hospitals, and then the students do go into the city. They go to Children's Hospital, different experiences sometimes in the city or more in the suburbs of Pittsburgh. So there's a real variety. They go in all different directions, to Johnstown, to Du Bois, to Pittsburgh, and then the majority of the students stay very local here to Indiana. They also get experiences. They do with the Visiting Nursing Association locally. You see various experiences the students get with physicians' offices, working with nurse practitioners. We even have students that go to our own health center here at IUP to get those types of experiences. One of the interesting things that came out of the pandemic, we had the local school district reach out to us for assistance. They needed some help during the pandemic, and they asked about the students coming. And they've been going to the Indiana School District ever since the pandemic. Students enjoy that. It gives them. They work with the school nurses. The school nurses are very helpful, and they get to see a little bit different role of nursing than in the hospital.
Great that students get to see different settings, different environments, and hopefully that helps them a little bit with their career decision-making of where do they see themselves practicing after they graduate.
It does. They get a nice variety, and then they're really excited, kind of have an idea of where they want to go.
For students that might have an interest in working in a rural setting, can you just share a little bit about, how is that different from perhaps some of the other types of settings, and what in particular maybe students need to be prepared for if they want to ultimately work in a rural setting in a nursing role?
Sometimes the students don't know where they want to work when they're finished. And there is an attraction to the young students that they would like to go to the big city hospitals. There really is. However, the longer they're in the program, the more they develop, the more they get to see different things. I think they appreciate the experiences they get in the rural hospitals. And the nice thing, I think, regarding our program is most of the faculty work in the rural hospitals. Their experience is there, so they explain that to the students. And we do have a number of students who then decide to stay local. And they might not stay in Indiana and work at IRMC, but they may go to Penn Highlands, or they're going to local hospital, Independence Healthcare, the Punxsutawney Hospital, the different hospitals in the area they may stay at and work at. I know when I teach in the lecture class, I always talk about the differences of resources we have in a small hospital versus a larger hospital. Really important that the students see that and how care is delivered a little bit differently. And I always say no better or no worse, just different. And there's positive things you can say about the rural health care that the urban settings don't have, and vice versa. And so you always try to point that out to the student.
Well, that's great for them to be able to see some of those differences and, as you said, understand that it's not a matter of one being better than the other, but just different and appreciating what some of those differences are. One of the things we hear about so much is the nursing workforce shortage, and I think there's a couple levels of that in terms of just individuals to fill staff nursing positions and challenges there. And certainly that was out there before the COVID and the pandemic, but I think that heightened it to some degree as individuals may have left the field to some extent. And also hear a lot about a shortage with nursing faculty, that one of the ways of getting more nurses is having more nursing programs, but there's a shortage and challenges with nursing faculty. Just curious about your thoughts of some of those workforce shortage issues in nursing.
Yeah, they're pretty significant. First of all of our students who apply for a job months before graduation, if they really want the job, they can have a job. So our placement data for those students, sometimes they wait to get employed, but it's 100% employment. And they pretty much get to pick the areas that they want to work in and the specialties they want to work in, which is entirely different than it was 10 years ago. 10 years ago, they would have told the student, oh, you've got to start out in med-surg or in this certain area. It's not like that anymore. I see students getting hired into real specialty areas because the need is there. The nursing workforce is aging and retiring, and there's a big opportunity for the students to get different opportunities that I know when I graduated we didn't have. You went to work at med-surg initially and that kind of thing. The nursing faculty shortage is significant, and I think it really contributes to the nursing shortage. It is extremely difficult to find nursing faculty. First of all, they need a master's degree in nursing as a minimum to teach clinical and theory. And then to be hired in a university, kind of like as a tenure track or a tenured position, they really need a PhD. They need a doctorate. There's a shortage in our area. And what I see is a lot of people are going on for advanced degrees and they're getting the DNP. So we have these practice degrees, nothing wrong with them, but those people are going into practice and they're not going into education. So I usually can find enough faculty to fill the classes that need to occur, but it's a challenge. And sometimes it's a friend of a friend and helping me find somebody, and especially for the specialties. Every year, sometimes it's a different issue or whatever, but sometimes you may have problems finding a psych nurse or an OB nurse or a pediatric nurse. So those specialties can create a problem. You might be able to find the nurse with the advanced degree, but they don't have the expertise in the specialty, and that's some of the issues, trying to fill those positions.
Thanks for sharing that. I'm just curious also on the student recruitment end, do you see a demand of students being interested and applying and individuals wanting to come into the nursing field, and what trends have you seen there?
Yeah, the students have always had an interest in nursing. Our numbers for the last decade, where a lot of enrollment has went down in different programs in universities nationwide, the nursing enrollment has been pretty consistent over the last number of years. Not this past fall, but it would have been fall of 23. We actually had an increase. And I'm not sure if it was related to people that didn't go to school because of the pandemic or what the issue was, but we saw a significant increase. We had a class of over 200 that year in the undergraduate. It was higher than normal. Usually we come in around 180, 190, somewhere like that as far as students coming in. Interest is there. They have to meet criteria to come into the program, and sometimes we have students who don't have the GPA requirement or don't have the science background to get into nursing. And then we try to provide a pathway for them to change their major after they're here. So if they are successful in taking certain courses and their GPA's high, they can transfer into nursing after they're here. There's a lot of interest in that. I hear from students all the time. They came to IUP, decided that they wanted to be a nurse, and they want to change their major. That's pretty common. I'll get an email about that, or someone showing up in the office pretty much almost on a daily basis. Yeah. So there's a lot of interest, and that's good.
Absolutely. That's exciting to hear, to know there's people interested in coming into the field and pursuing that as we look at the future. Just curious, are there any particular new initiatives or developments going on in the nursing department that you would like to highlight or spotlight?
One of the things we started about a year and a half ago, and it is really interesting, and it's the virtual reality. We started a virtual reality lab, and I can't say I was excited about it initially. I thought I didn't understand it. It might have been a generational thing for me, and then I saw how the students really liked it. They have the headset on. They're immersed in different clinical types of situations and how you would solve different problems. They're actually like in this virtual reality, they're in the hospital and the patient's talking to them and they have to respond and all that kind of thing. And it helps the students learn in a way that is safe, that they could make a mistake and they don't hurt a patient. And then the nice part about this is the students actually get a package that they can practice at home. If they don't have a headset, they can practice on their computer. It's not as nice as having the headset, but that's one of the changes that have occurred in the last year or so, and it has really, I think it's helped the students. They like it. We get good feedback about it. The students will go and they'll do a couple rotations in their clinical, and instead of going to clinical for that day, usually it's a lab day, and they'll do those different scenarios.
That's real exciting to hear how technology can be used, and just obviously can appreciate the importance of theory and the didactic part of education for nursing, but it is such a competency-driven field that know-how doesn't always translate into that can-do. And this gives people that chance to really practice those skills and say, can I take that knowledge and put it into practice?
Yeah, I think it really builds their confidence. So they feel more comfortable when they're going to clinical, interacting with real patients, and how to handle situations. So it's very helpful for them.
And I know even in the hospital setting, as we're providing training and education and competency development to staff, one of the challenges sometimes is some situations are very unique and they don't happen that often. So it's really hard to assess and prepare people for that. But it sounds like virtual reality could be a way of creating those simulations and letting them to experience something close to it.
I always think that the two things we should concentrate on with competency-based education are the things that we do all the time that have a high risk, and also things that we don't do all the time but also have a high risk. If you look at those two areas of high risk and you focus on those when you educate students or staff for staff development, you're going to handle most of the problems. It's going to build confidence, and the person's going to feel more comfortable in those situations.
Yeah, excellent point. I really like that way of looking at it. Are there any other trends or things happening with technology in your department?
We have continued to expand our high-fidelity simulation lab. So that area has become much more expansive than what it was when we initially started it about 12 years ago. We run high-fidelity simulation every Tuesday and Thursday for med-surg leadership and critical care. We do high-fidelity simulation for OB and peds 1 day a week. We also have standardized patients that we utilize for simulation. So we have actors, and sometimes we have people that are actually playing themselves. We have some people that come in that help us with drug rehab and how a psych nurse would deal with some of those different issues. Those people that come in and do that, they do a really great job. They plan the scenario. They kind of work with the faculty a little bit, but they plan the scenarios. So, students enjoy those. So it's how to handle drug-seeking behaviors, those types of things. And the students, I think, like that it's a person and not a mannequin. It's very interactive. It's a nice way to learn.
So lots of levels of different experiences, some with technology, some with real interactions, but giving quite a variety of things to prepare individuals for situations they might encounter.
Yeah, and I think so. Everybody gets something that they sort of enjoy, which helps their learning.
I'm curious, and realizing that your perspective is primarily as the chair of the nursing program, but there's a lot of exciting things happening at IUP with the proposed College of Osteopathic Medicine. I think the public health program has been growing, and just a lot of different initiatives and energy around the health sciences area. How do you see that coming together, or IUP continuing to grow to be an important part of rural health for our region?
I'm really hoping with the DO school opening here in the future, expansion of our allied health programs here at IUP, I'm hoping that we are able to provide high-fidelity simulation that involves all the professions together. I think they would, just like you would see in the hospital, the healthcare team working together. Right now, our simulations are more in a silo. We do some with other departments, but it's limited. And I'm thinking this will really change with the DO school. Right now, somebody pretends to be the doctor, or the faculty pretend to be the doctor in the simulations. It will really change, I think, with the school being there. I think it'll make it more dynamic. I'm excited about it. They're a great group of people to work with. We are looking tomorrow at inventory space, expansion of the buildings, and all that kind of stuff. So multiple people involved in the health sciences are looking at that tomorrow, trying to come up with a plan of how we're going to do this. And because there's going to be a certain area of the university that's going to be dedicated to health sciences. And we're kind of excited about that, and so that we had to take a survey, what kind of services do we offer now? What do we envision for the future? And I'm excited about that, and all of us getting together and discussing it.
Yeah, it definitely sounds very exciting. And, healthcare interdisciplinary teamwork is so critical to having the best patient outcome and the best patient experience as well. So they understand who's involved in my care, how are they working together, how are they communicating, and again, building those experiences early on and teaching the importance of that communication sounds like something that will have great benefits. You had a great career and continue to have a great career in the nursing field and now nursing education. What advice would you give to a student who's thinking about working in either rural health care or any of the health professions?
One thing I always tell students when they first enter nursing, they really want to commit to something that they find is like this is what they're going to do. And for some reason, they envision themselves in the same position for 30 or 40 years. And I'll say to them, one thing that's really great about nursing is it's constantly changing, and what you do in nursing, in the environment that you work in, and the expertise that you have, it changes. And so you can work in a variety of different settings. And if 20 years into your career you want to make a change, it is really easy to do. You can work in any state. You can actually work in any country. So there's tremendous opportunities for growth and change that the student can experience throughout their nursing career. And I always tell them to, remember as they're making decisions in their nursing career about how to take care of people and how to advocate, because healthcare is challenging today. I think it's much more challenging than it was when I first got out of nursing school. However, I used to always make decisions that, especially, I remember being in nursing leadership. It was patients first, then the staff, then the organization, because if you did that, the organization was going to be fine. And I say the same thing when I think about decisions here at IUP. I always, in the nursing department, students first, then the faculty, then the organization. If you focus on taking care of who the primary person you're supposed to take care of, it'll all come together. It'll all be okay. And that's one of the things healthcare is so complicated with, insurances and rules and regulations. If the student just focuses on, in their career, what's best for the patient, they'll have a more satisfying career.
Wow, that's great advice. Very interesting, and something I think, as you mentioned, very complicated situations, bringing it back to those basics would really help in many ways. My next question is kind of what they call the miracle question. If you kind of had the magic wand and could wave it and make, one change with policy or funding or support that you think would help nursing education, what would be your wish?
I would love to have a big donor that contributes to this beautiful new health sciences lab all in one location. Right now we're in 3 different locations for our labs. That would be the most beautiful thing. If something like that could happen, that would be wonderful. And I keep thinking there is a possibility that could happen, that there's a donor out there. We have a lady who donates every year to buy lab kits for our students. We found her by accident. She found us, we found her. She's a wonderful woman, contributes to the department. I keep thinking there's someone else like her out there that I think could help us. Maybe they win the lottery and they want to give to the nursing department. Because we're really looking at not just nursing, but that whole health sciences. How would that, a really nice integrated lab where students can learn skills, learn the high fidelity simulations and the virtual reality, all of that being together in one location. That would really be nice, because right now we're all over campus. Like, it's kind of piecemeal. We outgrew our building a long time ago. We probably outgrew it when we moved in.
Well, that's a very inspiring vision. So we hope maybe that's something that can come true here in the future. I really appreciated our time today and the opportunity to learn a little bit more about the nursing department at IUP. If someone listening wants to learn a little bit more about the program, what would be their best way of learning that?
They could, if you go to the IUP website, and you just type in nursing, we come up. It has all kinds of, like, has our curriculum plan, information, faculty. It's there. All the contact information is listed there. So that's probably the best place is just going to the website itself and, doing a little bit of search for the program they're interested in. And the other thing, let me just say, if somebody's out there and they think, wow, I would like to help nursing, but I don't know how, we occasionally have people who will call up and they donate supplies to us. And a lot of times sometimes they're expired, sometimes they're not. But a family member passed away or something happened, and or the hospital donates supplies. But if there's something there and you're thinking, oh, I'm going to just throw this away, could we use it? And we use dressings that are yellow instead of white because we're practicing. We're not using them on a patient. So we've had people donate crutches, wheelchairs, a variety of different things. So I guess for the local community, if there's something you have, before you throw it out, ask the question, maybe they could use it, and we probably could. We go through a lot of supplies, and we either have to buy them, we get donations, and then the hospital and also our health center gives us the expired stuff. We get a lot of expired stuff from the local hospitals.
That's a wonderful thought and reminder, and how satisfying that would be to know that rather than throwing something away, that you're doing something to support nursing education and support the development of future healthcare professionals. So thank you for sharing that idea, and hopefully a lot of people take you up on that. It's been a pleasure to talk today, and I want to thank you again for your time, Dr. Theresa Gropelli, Chair of the IUP Nursing Department, and helping us learn a little bit more about how nursing education is making an impact in our rural community.
Thank you. I'm glad I could share.
IUP Nursing Education, preparing the next generation of the nursing workforce through innovative and immersive learning experiences. Rural Health Pulse is a collaborative effort of the Indiana Regional Medical Center, Indiana University of Pennsylvania, and the Indiana community. It is produced by Chris Korn from the IUP Division of University Advancement and recorded by the IUP Communications Media Department. I am Dr. Jim Kinnear. Thank you for listening, and be sure to watch for future episodes of Rural Health Pulse.